Thank you, Dr. Jenkins, for a wonderful presentation. Let's start with opening the chat for questions. My question, and I'm going to ask this one while we're looking for others. In terms of the actual components that people are consuming, do we have an idea? We know that glycemic indices can be very similar for various foods across the different complexes. Are they taking into consideration the actual matrix in which these foods may actually be impacting? Say like an apple or a fruit yogurt or even a bran cereal can have very similar glycemic indices, but in terms of actual glucose and impact, do we have any better idea on how to handle these issues more so from like a practical standpoint?
I think you could, a good question, Nancy, excellent question. But you've got the same sort of issue with fiber, with dietary fiber. So I'm saying that's my worry. Once we get into the physiological situation, then you can give the physiological effect as you see it. And you assume that the physiology relates also to the pathology. You assume. But again, it's literally only a part. And I think what we're beginning to realize much more now, we didn't realize it 50 years ago, and I know that because I can speak personally about it. We didn't realize that when we talked about a nutrient like fat, that could mean a whole range of things depending on what that fat was in and what the diet in total looked like. We're now beginning to realize that you cannot make the overall indication. You can't discuss the overall indication. You can say that there's a chance that this may influence. And the same is so true, I'm sure, for selenium or zinc or whatever. It depends what food you've got it in. But even, what I'm saying is even more so when we get into the physiology and the pathology. So I think you're absolutely right. We cannot state absolutely what we're going to see, but we can say that physiologically, this is what you see. And that's why we're looking at the total food. Now, you're quite right. We're not looking at the total diet. And that's why I'm saying maybe we have to have dietary indices. In other words, I'm sorry, but I see this wretched thing continuing on as we almost include our nutritional knowledge into the food table.
Yeah. And then let me ask you this question. How much confidence do we actually have in how the data were collected? Using an FFQ or food frequency questionnaire, I know from a long time ago when I would use these in my patients, I didn't have a whole lot of confidence in them. It was more like a general guess of what these people were consuming. I can't remember what I ate yesterday. How can I remember what I ate a month ago when these FFQs are administered? And in some of these studies, they're asking people to go back 6-7 months or longer. What are your thoughts on this?
Nancy, it's really worrying. All I can say is that, I have friends, David Katz and others, who've been trying to make sense out of this by taking a picture of the food and saying, what class of food is this in and what type of diet is this likely to represent? I think you're absolutely right. It's very difficult. I have been reassured to some extent. They're talking to Walt Willett, and Walt's been saying that he's been finding that the one-day recalls seem to correlate quite well with food frequency questionnaires. I used to say, well, you can't do that. You've got to have a 7-day weighed food record. And he says, well, the correlation is actually pretty good, even if you have a one-day recall. So in one sense, I'm saying, yes, you can have actually more confidence. And then I think, well, no, you can't have a lot of confidence because there's such a variation in what we eat, and you don't know whether that one day, even if it was well recorded, is actually representative of what you're actually eating. Because to be honest, what I'm going to eat today is very different from what I ate yesterday. And I don't have a regular pattern. So I think this is what the question you're asking is very relevant. The only thing I can say is that to the nihilists, I would say there is actually some use. And to those who have absolute confidence, I would say the nihilists don't believe us. and they
No, I
have
think
some justification. So I think it's somewhere between don't believe and believe.
no,
I wish I could give a
totally
better
agree.
answer. What do
And
you think? What do you think?
I totally agree with you. I am always concerned whenever we're looking at correlations from a statistical mathematical perspective. Correlation does not infer causality. And I think it's really important to keep that in the forefronts of our minds when we're
Absolutely.
looking at these data. And I've had conversations with David Katz about this. I've had conversations with Walt about these types of things when we're talking about study design issues. And so just because there's a correlation, that doesn't mean there's causality there. So
absolutely. And then for the clinical trial, it really depends what your control is. You can make something really good if you have a bad control.
oh yeah.
If you have a very good control diet, you can show that your new diet has no effect.
Mhm.
So again, we've got to worry about the clinical trial
Mhm.
and the cohort and the correlation and the fact that with a lot of pride, we say the clinical trial gives us evidence of causality. No, not necessarily. So all I'm saying is caution. And I think that's where the food tables are helpful, because they make us think a lot about what we're doing. And I think over time, their use and their use in many directions, the cohorts, the cross-sectional, the randomized controlled trials, the trials which are not actually randomized, etc., etc. I think if in all these situations you start to see the same sort of pattern, then I think you have a greater degree of confidence. Don't you think?
I definitely agree with you. We have a few questions in the chat. I don't want to take up all of the question time, but let me go ahead and read this off to you and give us your impressions. The question is, can you comment on how we would measure sustainability or healthy planet for individual foods? What are some of the measures? Let me see here. What are some of the measures developed across disciplines beyond our dietary world? So I think what they're asking you is, how do we do this in the real world? How can we actually look at what people are eating? What are your recommendations? I can tell you now, NCI is looking at putting together a notice of interest, hitting exactly the same target, but to be candid with you, it's really tough to get people to come in with great ideas, and we're struggling with this. Do you have any words of wisdom? And I think the attendee hit it spot on. What do we do? What do you recommend?
Nancy, I think this is absolutely right. And we were putting together a grant application. But no, and that's it.
Oh, thank you.
That's it. But I do think, and we might, who knows? But I do think you've hit the nail on the head. That is very difficult. But we can say, and we will do it, obviously, it will need a lot of artificial intelligence, to be honest, to mastermind the vast amount of data that you will have to collect. For example, on a Mediterranean diet. What is a Mediterranean diet? Are we talking about Italy? Are we talking about Greece? Are we talking about the current diet, or are we talking about the diet 50 years ago? Again, but one can look at the sorts of foods that seem to contribute to these diets and then start saying, well, these sort of foods seem to contribute about X%. It's going to be very crude, but I do think it's feasible. I think we can do it. I think then you're absolutely right. We take it, we look at this profile in our cohort studies. We then construct randomized controlled trials and look at putting together these sorts of diets and a variety of these sorts of diets, all with the same sort of index, if you like, but with different foods, and seeing whether we get the sort of physiological effects that we expect. Ask us to do a long-term trial, and that's going to be a lot later. You're going to be doing that probably in about 2035, 2050. So prepare yourself for that. I certainly won't be around, unfortunately, to help you with that or to clap my hands when you're successful. I'll be someone else's dart, as I say.
Our next question comes from Johanna, and She says, thank you for a fascinating talk. My question is, as we go from nutrients down to humanity in the food table. Let me see here. It seems to me, see if I could get this all on here. My laptop is being a little crazy.
Thank heavens you're doing it, not me.
The question is basically, how are we handling this? Johanna, if you can go ahead and pull yourself off a chat, if you'd like to go ahead and answer it, go ahead and ask your question directly. That would be most helpful, as I'm trying to very gingerly advance on my laptop with my
Joanna sounds like she's got a very important question. So
she usually does. She's very curious about how we're going to sort some of these things out in the
very
real
difficult.
world.
I know, I agree entirely. It's going to be very difficult, but I do think we can take a look at estimated greenhouse gas emissions. That's one thing that there are a number of databases that are now being constructed. They're difficult, and basically they have to be right from beginning to end, as it were. You've got to have a complete life cycle analysis. So that becomes difficult. But I think there are, we've looked at about 6 or 7 of these major databases, and I have to say that even though they may not have actually contacted each other on these issues, they do seem very similar on most of the major issues. And I think one can say that because I think one can say that ruminant meat is definitely higher on the list than beans and lentils, do you know what I mean? And that goes for everything. It goes for the agriculture, it goes for water use, it goes for all these sort of things. So, and industrialization that's required in order to produce these sorts of foods is quite different. Storage problems are also different, etc. Transportation. So these things are all factored in, and they do come out looking the same, whichever way someone does this or some group does this. So I do think that one can have some care, some confidence that these sort of things can be handled, not perhaps massively accurately. And when you're talking about what about grass-fed beef versus regular beef, that's when you get into more of the issues, because you're dealing within one particular food, which may be very different from another quite different food, but between things that are closely similar. That's where I think one's going to see the discussion, and I think that's fair.
I was able to get my laptop to cooperate a little bit better, and I can see the rest of her question. So thank you for your patience. She's asking, in terms of this, it seems like some of these columns of data that are listed are somewhat subjective. What standards are we going to be meeting in the future, as some of these numbers may actually be prone to error based on, how it's being analyzed, where it's coming from in the field? Is this a one-shot deal based on a farm in Iowa somewhere, or is this a farm in Louisiana or out in California? How are we going to resolve all of this data being more of a mishmash, and we don't have, I guess, for lack of a better term, absolute certainty that these numbers are reproducible? How do we handle this?
I think, as I said to you, I think we're quite good at the major differences in foods. We're not so good on what's corn grown in Iowa, what's corn grown somewhere else. So that we're not good. We're not even good at a tomato grown in Mexico and one grown in British Columbia, in Canada. They will be different, because one will use greenhouse gas, etc. One will be growing it in a greenhouse, sorry, not greenhouse gas, one growing it within a greenhouse, whereas one's grown in an open field. But the one grown in an open field needs transportation. The one grown in a greenhouse doesn't. So there are going to be a lot of things that we have to put into this. I don't think that's the major issue. And I do think we can resolve these things and say what it is for different places later on. We don't have that yet. It'll be more specific later on. We're just looking at the generalities now, but you will have difficulty if, for example, my daughters would like us to put together a humanity index, that is there you have some real difficulties. Do you know what I mean? But I do think we should try and address it. Not that we're going to be successful first time, but I think these are the sorts of things that the food tables have always been iterative, right? We've always produced new food tables, and we're going to have to produce new food tables, and some parts of the food table will have to be revised very frequently. We don't put enough effort, we don't put enough money into food tables, quite honestly. That's a great worry that I have. We don't put the money in. We don't revise them enough. I mean, cornflakes, when they were first brought out by the Kellogg family, are different from the Kellogg cornflake today. Do we know? Well, not particularly, because we did an analysis and we're not really worrying too much about redoing everything, because you've got vast databases to redo, but we have to.
Now, I think that was part of Johanna's question as well, was on a humanity index. And then part of another question that we've received is, if a standard would be useful, who would be the person or the organization to promulgate such a standard? Any thoughts on this?
Yes, I do think so. I think that we've got analytical standards, and I think that they probably will have to start thinking more closely about the more woolly things that we're going to be producing and how to put standards together for this. And I do think there's a big opportunity for external agencies, and perhaps your own group and people of that sort will form groups that will look at specific areas of the database. And I think that will be important. And you'll put these, presumably you'll put these forwards as issues that you want your community to address, and these you'll come out with standards. You'll link up with other organizations doing similar sorts of work, and I think we will all together have somewhat different standards for a time, and then they will tend to coalesce as we see the science moving in one direction or another. So I do think this is a very big field that you're dealing with, and I think you folks could be congratulated in where you're going, and I think this field is going to explode, is all I'm saying.
No, I think you're right. And then we have a question on if we're going to be adding columns into some of these databases. Let me see if I can gingerly scroll down enough. Are we going to be including things like environmental impact, even humanity? What exactly would be useful things to be including in these databases as well, so that you could actually read across different tables to know what you're actually comparing? I don't know if that's exactly what they mean, but I'm reading off what they typed in there. If I did not convey the spirit of your question, please feel free to unmute yourself and step in.
I think it's a very good question. In other words, when you have a column, what does it compare with? I mean, you can compare zinc with zinc right the way across. Once you get into the physiological stage, what is the comparison for a physiological or pathological index that you've got in that particular column? I think those are really important questions, and I think we probably, that's one of the things that I think when you're dealing with these columns, and when you're dealing with what we should add, and when you're dealing with a group such as yourselves who might be interested in particular columns, I think those are the issues that you've got to decide. Is a standard necessary? And if so, what is it? And what do we conclude from it? I think these are issues that we have to address. You're absolutely right. But all I'm saying is that I think there are certain things that really possibly should have a place in a column. And I'm not saying that, obviously the columns go on, and even the columns that we've got today, I don't know what zirconium does in a food. I haven't a clue. But it's somewhere at the end of the column. Do you know what I mean? So I would suggest that we are probably going to put these things in books. It's going to have the same foods, but it's going to have quite different contexts and columns related to it. So you'll have your mineral book, if you like. You'll have your antioxidant book or whatever. I see this as being something that is going to be enormously important for nutrition. We can do this now that we've got the computer. And as the computer gets better, we'll have more columns and more books.
So I am able to access more of the questions. Thank you to our support group for posting them in the chat. We have a question here that's asking you to please comment on your knowledge of the status of meeting soluble versus insoluble fiber status in the fiber composition tables. I know at least my organization is very interested in it from a cancer standpoint. Could you comment on it for global use and interest?
Yes, I think, again, you're talking about a physical state of the fiber. We're not talking about a chemical state. And that's really quite important because what a fiber breaks down into, whether it's soluble or insoluble, is another important issue. I, to be honest, have seen little difference in terms of soluble fiber and differences between soluble fibers, but that's because I think people have not divided the soluble fiber into those that are viscous and those that are not viscous. And so that the total term soluble fiber doesn't mean a great deal to me. What it does potentially mean is that it is likely, when it enters the colon, to be rapidly fermented. So that's one thing which an insoluble, and the degree of insolubility is also important, because wheat bran is tremendously insoluble. I don't know whether you've ever wiped yourself after you've had a diet of high wheat bran. And you will, if you look on the paper, probably wouldn't bother to do this, but if you look on the paper, you can actually see the fiber parts. You can see the actual anatomical parts of the cereal grain, for example, of the wheat grain, as the fiber source. So there is very little broken down. Whereas if you take something like cabbage fiber, which does also have quite a lot of insoluble fiber, even that, though it is insoluble, is relatively well broken down. So along with its insoluble fiber, which is broken down rapidly, plus the soluble fiber that's broken down rapidly and the insoluble fiber, you will find that you get more flatulence sometimes as an indicator of this when you take a lot of cabbage. So I think that short answer, we don't really know enough to derive a meaningful classification into soluble or insoluble, although we do know that fermentability does tend to be more impacted by the soluble fiber. So fermentation will be quicker, and the accumulation with insoluble fiber of other things like phytates, which may bind metals and these sort of things, all will be related more, almost entirely, to the insoluble fiber fraction. We really have a lot more work to be done in this area, so please do more work, and then let's make the claims accordingly.
No, I totally agree. We have another question. You're getting lots of questions. Please, I hope you don't feel like you're in the hot seat.
No, I do feel that that's why I left a lot of time, because I think that the issue is tremendously contentious.
I think it's really important, and I think people are asking really good questions. I think they're really thought-provoking questions.
Absolutely.
So the next question is, if we add all sorts of things associated with foods in composition databases, how in the world would we expect these aspects to be reported? So if we're adding all of these things in dietary fiber, do we need to break down the databases into, individual databases, like one for like lignans, one for things like arabinose? I mean, how do we handle this data?
Well, that's what I say. When you start getting a comprehensive understanding of certain aspects, you will probably need, and I'm calling it another booklet, to the table, where you will have a number of these columns and you'll have the physiology, you'll have the pathology, you'll have everything else. In other words, you will have something which is more comprehensive than we have today. What I'm saying today is very skeletal. You may have quite a lot of minerals, et cetera, going off into the distance, but because you can measure those, we don't even know the bioavailability of those minerals, which is tremendously important. So all I'm saying is that the databases that we have today will be looked at in 50 years' time as being fairly primitive and quite easy to get your head around, but not very useful. That, I think, is what we're going to say. And we're going to say we marvel at how people in nutrition and dietetics manage to find their way around with such poor tables.
Yeah, it's definitely quite a conundrum. Here is a comment, and I think they're asking for your opinion on this. They're asking about whether or not there needs to be inclusion of specific agricultural production practices by geography, and a need to reach out to egg economists, soil scientists, and egg technologists to help get some of these databases more suitably aligned. I think that's a great point.
It's a great point, and I can only say yes.
I definitely agree. Okay, so I'm looking to see how many other questions there are. My apologies if I missed your question, as again, I am operating on a laptop, and this is kind of a challenge to find all of your questions. If I don't get yours, please accept my apologies ahead of time. I don't mean to exclude anyone, but I would encourage you to directly ask Dr. Jenkins if I miss your question. I am scrolling down, and there are many comments in general. A lot of these we've already addressed already. So I'm looking for questions that have not already been asked. I think there are some really good points. We need to think very critically and analytically how we're going to get these fiber databases online into a usable format. A couple of years back, I gave a talk to a bunch of surgical oncologists who are very interested in dietary fiber. They're very interested in the different types. And I know that at least in the US, there are efforts to align the fiber data information with the functional fibers that the US Food and Drug Administration has agreed that can be put on packaging. So in terms of this, if we have better ideas how we can handle this, I think that would be worth its weight in gold on how we can help USDA to better post some of this information so it's in a much more usable format. So it seems like your thoughts are leading more towards putting up separate databases and not just including fiber as fiber in the standard releases and things like Food Data Central.
I think that's right. I think what you're quite right. What I'm saying is that I think we will have to evolve, I think, into booklets. And those will help your oncology friends because they will be able to look and say, well, let's look at the food and let's look at what we've got on fiber on it. They will be able to see whether it's viscous or non-viscous, whether it's soluble or insoluble. They'll be able to say whether it contains a lot of phytates and other materials, whether it binds these, what it does, what its suggestibility rate is, these sorts of things. At present, we don't have these, so that they just see fiber and it means nothing to them. It means just what you've got in the literature. We haven't made any attempt to fashion the actual potential functional fiber. And it is a functional ingredient because we're not saying it's got so much arabinoglycan in it. We're not saying exactly what it's got in it. We're just saying this is a fiber. It could be dextrins. It could be all sorts of sugar analogs. We don't know. And we don't know what these break down to and how much of them break down. We really don't know.
Exactly. No, I think you're absolutely spot on with this. I know I use the oncology example, but at meetings I've run into cardiologists and endocrinologists, everybody wants this data and they want it for their populations. Cancer is a late endpoint, but I think that this was an amazingly important topic. Thank you so much for an incredible presentation. I suspect they're going to be calling you back for additional information and getting your thoughts on it. And I just want to put a shameless plug in the last 2 minutes that we have, in case there's another question that comes up. Please make sure that you look at the NIH website for all of the information across the different institutes that people are looking for. Food composition is critically important. We need it not just for research, but we need it for taking care of individuals in healthcare settings as well, and for prevention studies in high-risk populations. So please look for those postings as well over the upcoming year. Any concluding thoughts, Dr. Jenkins?
Well, no, I think, Nancy, thank you very much. I think you've managed to curate these questions brilliantly. So thank you for that. And I do think that the direction that we're going into is unfortunately more complexity. But I do think that that complexity will allow us in the end, to answer the sorts of, or make an attempt at answering at least some of the sorts of questions that you're raising. I do think that we are in a very complex situation with the database. And I think that many of the things we want aren't in the database, and many of the things we're truly not that interested in are in the database. So I do think separate booklets is going to be required so that people can look at the area that they're particularly interested in.
Join me in thanking Dr. Jenkins for an outstanding presentation. Thea, I'm going to turn it back to you to continue our event.
Great. Thank you once again. Yes, now we're going to have a quick health break, returning in 15 minutes at 11:30 a.m. Eastern to begin our session 1 government database updates. See you then. Thank you. And a reminder, if you don't need to take a break at this time, you can enter the Gather space and check out our poster sessions. You're also able to interact with other attendees in that virtual space and have conversations.